thank you so much, everybody, for joining us. I can see people are introducing themselves in the chat, so that's fantastic. It's so lovely to connect with you guys. And I think we talk to a lot of you probably every day on Twitter and Facebook and Instagram anyway. So it's lovely to have this space where we can kind of speak to each other a bit more. My name's Julia and I run EveryDoctor along with the team who are all here this evening. We've decided to run a webinar this evening to let you know why we're running a campaign called #ScrapNHSBill, which I'm sure you've seen us talking about elsewhere. We're talking about very little else at the moment. We're extremely concerned about the Health and Care Bill, which is going through the House of Commons at the moment. And as you know, it's going through its third reading in the House of Commons currently. It's being voted on by MPs probably tomorrow, and it's going to have huge impacts on the future of the NHS, on our patients and on NHS staff. And so we wanted to let you know a bit about the history of NHS privatisation and how we've got to where we are today. So I'm going to start and then I'm going to be handing over to another member of our team called Megan, but I'll explain in just a sec who Megan is. Hannah, could you move on to the next slide, please? Brill. Okay, so I'm going to start the presentation today, and my name's Dr. Julia Patterson. The other presenter today is called Dr. Megan Smith, and Meg is the head of policy and legal at EveryDoctor. You've probably seen her tweeting as well. Then we're going to move on to a question and answer session, and we'll finish at about all the timings here are wrong. We'll finish at about 7:15. Sorry, this is the second time we've done this presentation. So the other time it was in the morning. If you've got questions as we go along, please just pop them in the chat box. Someone from our team is going to keep a list. And then when we get to the end of the presentation, we will start answering those questions for you. Okay, fantastic. Hannah, could you move on to the next slide, please? Great. So we're just going to start with a little bit of history about the NHS. So the newly formed NHS in 1948 aimed to provide care for everybody from cradle to grave. And Aneurin Bevan, who's seen as the father of the NHS, described it as a milestone in history, the most civilized step any country has ever taken. Privatisation has been creeping into the NHS for 3 decades now, and the Health and Care Bill is going to accelerate that. But privatisation has always loomed over the NHS. In 1948, when the NHS was first set up, we moved from a model of private healthcare, where there were philanthropic schemes, where rich people were giving care to people who couldn't afford it, but in a very patchy way, to a system across the UK where healthcare was provided for everybody, free of charge. Creating the NHS involved swallowing up a lot of those patchy cottage hospitals and small local health services which had been set up by rich benefactors mostly. We didn't just build a nation full of new NHS hospitals. It was a messy, patchy business, and there was actually a lot of resistance politically at the time when it was set up. There were conversations about what should be provided for, what shouldn't be provided for, who could afford what. It was quite similar to how it is today, to be honest. And it's been a battle all the way along. A lot of us really love the NHS, but there's always been political pressure upon it to save money or cut things. One of the services that was provided in the beginning, when the NHS was first formed, was dentistry and also optician services for everybody. Hannah, would you be able to go on to the next slide? So there was an overwhelming demand for the optician services of the NHS. So it says here, free metal spectacles for all were among the first things to be cut from the NHS scheme by Labour's Hugh Gaitskell in 1951 on the grounds of costs. Financial constraints on the NHS are nothing new. So one of the things we wanted to highlight throughout the presentation is that the political pressure on the NHS has come from multiple sources and multiple political parties. We certainly feel that the last 11 years have been terrible for the NHS in terms of cuts, cost savings, understaffing, and the rise in NHS privatisation, which really is accelerating. But one thing that we're going to try and highlight today is it's just not the Conservatives alone who've damaged our NHS. And we really do need to scrutinise the actions of all political parties. So what I've put about the spectacles in front of me, it says the scheme was initially costed at £2 million for glasses for the first 9 months and £3.5 million for the whole year. These figures were woefully inadequate. The actual cost for these periods was 11 million for 9 months and 15 million pounds for the first year of the NHS. By 1950, the cost of providing glasses had risen to 22 million a year. In Scotland, 4 times as many people as predicted came forward to use this service. By the end of the 1940s, because there was such a demand on services, there could be an 18-month waiting list. One problem being that your prescription might have changed by the time that you managed to get hold of some glasses, and they were cut. The NHS has been politicised right from its inception, and it's a core issue for UK voters. Changes have been made by successive governments, and they haven't always been good. However, what we want to talk about today is that in recent years, steps towards privatisation have been made covertly, and it means that lots of people don't understand what's going on. What we have found as an organisation is that in talking to politicians, many Conservative MPs are not honest that privatisation even exists. They tell us that the NHS will always be free at the point of use, and that's not really what we're talking about. There's lots of privatisation in the NHS currently, even though people aren't asked to provide a credit card when they go to the GP or A&E. And so our view on privatisation is that there should be no private company profiting from the NHS. Currently, 7 to 11% of all NHS budget goes to private companies, and it has fragmented and destabilised our NHS. We want it to be eliminated, and we want this bill to be scrapped. I'm just going to talk you through a few things that are bad about privatisation, and then I'm going to hand you over to Megan for a little while. So private healthcare providers are less safe. It's been estimated that 6,000 patients each year required NHS care after failed treatment at private hospitals and clinics, and around half of that number were emergency cases requiring admission to an NHS A&E department. So sometimes work that's done in the private sector results in the NHS having to pick up the pieces because the NHS has all of the services that a patient might need. And that's going to add a cost to the NHS running a public service. So it makes no sense. Private providers can act as a parasite on NHS staff, poaching staff, and the public sector is the place that has funded this training of staff. And so a lot of people don't agree with NHS staff then going and working in the private sector. And at various time points to various governments, NHS privatisation has appeared appealing. It's a cost-saving measure, often in the short term, but in the long term, it often actually proves to be more expensive. And we're going to go on to explain a bit more about that. Privatisation of the NHS affects all elements of the healthcare service. For example, my background is in psychiatry as a doctor. And at the moment, because a lot of beds have been cut within psychiatry, sometimes if you see a patient who's very unwell in an A&E department, there might not be a hospital bed available locally. That can sometimes mean that a patient who's very unwell, sometimes psychotic, definitely who needs the care and attention from their loved ones locally, may be transported hours and hours away to the other side of the country in order to be able to access an NHS psychiatric bed. And when I say an NHS psychiatric bed, many of these beds are actually in the private sector. Because we've cut so many beds, we're either sending patients to the other end of the country to find a bed, or indeed sending them to the other end of the country where the NHS fund private beds because that's the only place that patients can be housed. And it's a terrible system. Psychiatric patients don't receive enough advocacy, and a lot of people don't know that this is happening at the moment. We believe that we have currently moved away from the public healthcare system that Anya and Bevan envisaged. EveryDoctor believes that we should be getting back to the principles of the NHS. That is what we believe that the public wants, and that is what we believe is best for our patients. We are desperately concerned for patients' welfare, and so we believe that this bill needs to be scrapped. But anyway, I'm going to hand over now to Megan to explain a bit more about the timeline of how things have developed over the last 3 decades.
Fantastic, thanks Julia. I just want to check first that you can hear me. If you give me a thumbs up, then I'll hopefully know that everyone else can. Fab, thank you very much. My name is Megan Smith. I am, as Julia said, Head of Legal and Policy for EveryDoctor. I've got a dark history in that I was a practicing barrister and now I am again, but I also work as my day job as a consultant anaesthetist in the NHS. So I'm a full-time NHS doctor. I'm also old enough to remember the good old bad old days of the NHS back in the 1980s, before the internal market was invented, and that was really the beginning of the end for the NHS, inventing a market, an artificial market, and then making hospitals and healthcare providers compete with each other. And that happened under the government of Margaret Thatcher initially in the 1980s, and prior to that, your GP was kind of the gatekeeper to your access to services, to healthcare services. You'd have a family doctor. I'm certainly old enough to have had the same family doctor for a very long time until I moved away from home. They would also provide the out-of-hours care. So if there was an emergency, it would be your doctor or one of the doctors from the practice who would look after you. And then they deal with your local hospital. If you needed to be referred for specialist services, they deal with your local hospital. It wasn't perfect as a system. No healthcare system is perfect, but it wasn't bad. But Mrs. Thatcher was ideologically and vehemently against pretty much all public services being in the public sector, and believed in privatising everything, essentially. So look at British Rail, British Gas. The list is pretty long and almost endless. So she reorganised the system into this internal market, and she gave health authorities, as they were then, a budget, gave them some money and said, okay, you go and buy the services that you need from the hospitals that you want to buy them from. And that made the hospitals who were dependent on that income to be able to survive, it made them compete with each other. And what we really want in healthcare is not vast levels of competition. What we want is collaboration. As part of my everyday job, I don't compete with the cardiologists or the gynecologists or the oncologists. We work together to try to work out what is the best course of action, the best course of treatment for the patient. And the same should be true, and has been true for a long, or was true for a long time, where the GPs would work together with the local hospital and vice versa, together with community services and vice versa. What you don't want is for these different parts of the service to be pitted against each other and made to compete against each other, because this isn't a business. This isn't a car company or a company that makes clothes or Coca-Cola. This isn't about profits. This is about healthcare. It's a fundamental and basic human right, and access to it is a fundamental basic human right. So Mrs. Thatcher sort of brought in this market, and then her successor, John Major, sort of floated and came up with the idea of private finance initiatives. So this is kind of in the 1990s. And these were introduced, I'll explain a bit more about them in a moment, but they were introduced in relation to all sorts of public services, not just the health service. And a lot of private companies, basically what happened was that a private company, very often a private equity company, so basically just a money person, would provide the funding for the construction of, whether it's a bridge, a road, a hospital, a school. They would provide the funding, the initial funding, and then they would basically lease the facility back to the public sector. So they've been paid by the public sector, that they lease it back to the public sector, but usually at extortionately high rates of interest. And I'll come on and talk later about a couple of those in the public health sector, which are eye-wateringly high levels of interest. But interestingly, the one thing that John Major wasn't willing to do in relation to any of these projects was to basically underwrite the debt, so that if the public sector couldn't pay, so if it was a hospital and the hospital went bust, the private companies wanted basically an insurance policy. So they wanted to guarantee that they would get their money back. So either we make a profit, and if we don't make a profit, and if money is owed to us, then the government will pay us anyway. So it's kind of a win-win-win-win situation for them. And John Major said no to that. And so interestingly, under the Major government, the uptake for private finance initiative schemes for hospitals was zero. And it's interesting because Julia said at the start that this isn't a tale of one political party facilitating or being complicit in the privatisation of the NHS. Every party that has been in power since Margaret Thatcher's time has played its part. And so in 1997, New Labour under Tony Blair decided that they would underwrite this debt. So where John Major said no, Tony Blair said yes. and unsurprisingly, with effectively a win-win, a complete guarantee, the private equity companies, big banks, major multinational corporations absolutely bit their hands off. And so by the time, in the first couple of years after this underwriting was brought in, over 100 projects were started, over 100 PFI projects were started for, in the health service. So what is the problem with PFI? Part of it is that it's a bit of a fiction, really. It's a way of keeping the cost of public facilities off the books of the Treasury. So it makes it look like we don't really have to pay for these things. So what you do is effectively take a loan from another company. They build your hospital. You pay them rent. Effectively, you pay them a fee, an annual fee. And over a period of time, you will pay them back a huge amount of money. Let me give you a couple of examples here. So Barts Health in London here, it's a beautiful, sparkly new hospital. I did some of my training in it. It looks a bit like being at the Tate Modern in parts of it. It's great. It cost £1.2 billion to construct. So for the private equity company that built it, that's what it cost them. Over the term, so it's usually about 20 to 30 years, over the term of the agreement between the NHS, between Barts and between that company, Barts will repay £6.2 billion to the company that made the initial loan, effectively. So that's a £5 billion profit for that company, straight out the bag. £5 billion of profit. Similar story for the Princess Royal University Hospital, which is down in South London. That cost £120 million to build for the PFI company, but they will pocket £1.1 billion. So another £1 billion in pure profit. I've mentioned private equity, I've mentioned big banks. Of course, most of these entities are located offshore. They're in tax havens. They don't pay tax in this country. So not only are they taking the taxpayers' money up front in terms of the repayment at vastly inflated rates of interest, but they're not even they themselves are rarely paying any or much tax in this country, and there's no kind of trickle back into the country of that profit because it's gone, it's offshore and it's elsewhere. So it's sucking and draining taxpayers' money out of the country, and we're getting nothing back for it other than a massive debt. The other kicker with the private finance initiative is that the companies that lend the money usually then make it a requirement that they or their associates provide services to the hospital. So that's most often things like cleaning services, lab services, catering, transport, all that sort of stuff. It basically gets subcontracted out. The maintenance of the, changing a light bulb gets done by a subsidiary of the company. And of course, there's no competition for any of these particular service provision elements. And so if they want to charge £750 to change a light bulb, then they charge £750 to change a light bulb, and that's what the NHS pays. So the NHS gets absolutely scalped from all directions, basically, by PFI. It's all in all a very, very bad idea, but it's what we're lumbered with at the moment. The total, so something along the lines of £11 billion worth of projects will have been funded by PFI, but those projects over their terms will cost the taxpayer over £60 billion. So that's over £50 billion of pure profit from taxpayers' pockets going straight to these companies. So in 2000, New Labour took another step and they introduced the ability to outsource for GPs, essentially. So for things that were sort of easy operations, things like hips, knees, cataracts, routine, straightforward patients, uncomplicated, private companies were allowed to tender for these contracts and provide them. Julie has mentioned some of the shortcomings of private companies operating in healthcare. I worked, as part of my training, I worked in a private intensive care unit in Australia, and I left that job early because I felt so morally compromised by the way that things were run. So it is true that they are less safe. They're not transparent. They hide behind commercial confidentiality. They're not subject to things like the Freedom of Information Act, for example, that the NHS is subject to. So in the NHS, when things go wrong, and they do go wrong, we have a culture where we try to learn. We have to be open. We've got duties of candor. We have to explain to patients what's happened. We can't hide behind a commercial contract and say, well, we can't really tell you about this because it's, it's commercially sensitive information. So they're not open. The other thing is that as Julia mentioned, the NHS picks up the pieces, and I've been on duty in this country where we've admitted a patient in through A&E and into our ICUs who's had an operation done in a private hospital, and it's either gone really badly wrong or their post-operative care has just been poor, and they've been admitted to us. The NHS picks up the pieces and it picks up the bill every single time, because that's what it's like, that's what we're there for. I'll give you a couple of examples of some of these companies that were supposed to do sort of quick, easy, straightforward operations, and basically they cherry pick those patients. They pick the straightforward, uncomplicated, easy ones to do because it makes money. If they're the straightforward cases, they should have a low complication rate, but a lot of them don't. It's really scary. So there's a company called Netcare PLC, which is actually a South African healthcare company, and they got literally flown in to the Isle of Wight to do orthopedic and cataract operations. This was about 10 years ago. Not doing any of the complex cases the NHS does. They had an incredibly high rate of complications, and it's very difficult then when a patient's had a problem, they've all flown back to South Africa, and you're left having a fight about who covers the costs and who makes good the damage. Another example is a company called Musgrave and Vanguard, who work together to provide cataract operations down in the southwest. They agreed, which is what private companies will often do, they agreed to do 20 cataract cases a day. Normal busy list in the NHS will be about 14 a day, so 7 in the morning, 7 in the afternoon. And that's not because anyone in the NHS is lazy or can't be bothered. It's because that's pretty much all you can really sort of safely concentrate on and do. And you're dealing with people's eyes here. 4 days into that contract, it was terminated because the complication rate, they'd done 62 patients and 31 of them had had complications. That's a 50% complication rate in straightforward patients, where the NHS complication rate for all comers is 5%. So, you know, orders of magnitude worse. And one of the reasons that this happens is that private companies, when faced with a shrinking pot of funding for the NHS, because that's what we've been faced with certainly since 2010. That was one of the things that New Labour was very good at. They increased NHS funding overall, but where your pot is shrinking, and that's the only source of funding, the way that you make money as a private company is you reduce the number of people that you treat, you get rid of the complicated, expensive patients with diabetes, Crohn's disease, rheumatoid arthritis, ongoing chronic conditions, multiple conditions. They're expensive. Private companies do not want you. You cut corners, you cut staff, you cut your costs basically in order that you make a profit. So that's what happens. 2004, the alternative provider medical services was a similar sort of next step. And I'm not going to kind of go through that in too much detail, but essentially it was moving again to say GPs could, where GPs would normally provide out of hours services to look after you and your family, New Labour allowed GPs to opt out of that. And I can tell you from lots of personal experience, as can most doctors, that being on call, being bleeped and called in the middle of the night and having to dash in and do something is not the most fun part of the job. After a time, it gets pretty tiring. So of course, GPs bit their hands off and were very happy to say, okay, we won't do the out of hours. So private companies stepped in to provide the out of hours service. And they then managed to kind of inveigle their way in to provide some of the daytime care as well. Again, as I've said, why is this a problem? It's because private companies have shareholders and they are profit-based. So they cut costs, they reduce safety, they overtreat. That was the primary reason that I left my job in Australia. So operations were done there that would never have been done in the NHS, not because we couldn't afford it in the NHS, but because it was absolutely the wrong thing to do for that patient. But over there, it pays money. The doctors get paid, the hospital gets paid, so they do them. It's a classic problem in the United States, where overtreatment happens all the time. Procedures, operations, investigations, all completely overdone. The other thing that they do in the States, a number of the companies that are trying to get into the market here, in the private market, is that they dump patients. So when they run out of insurance, they literally stick them in a taxi, drive them downtown and dump them. And for anyone who hasn't watched Michael Moore's film Sicko, I highly, highly recommend it to you, and recommend that you recommend it to lots of other people as well, because that is what the US is like. And it's not where we want to be. But it's where this bill is taking us. It's where we're heading. I've mentioned about cherry picking patients and paying tax offshore, not paying any tax offshore. Julia's mentioned that they don't train staff. The other thing that happens with private companies or private healthcare is that they often don't have good emergency backup care. So they often don't have an ICU to deal with patients who suddenly become unstable or unwell. And usually their out of hours cover, their nighttime cover, is provided by one or two medical or surgical sort of maybe 2 or 3 years into their training, doctors who haven't yet been able to find a training program in the UK that is happy to take them. And that doesn't mean they're bad doctors. It just means that the ones who are in training are the ones who are getting all of that extra education, and the guys who aren't are the ones who tend to be looking after the private patients. They don't train staff, as I've said. And then one of the absolute kickers is that if they don't make any money, they walk away. The NHS never walks away, never walks away. One example is Circle Health at Hinchingbrook Hospital, where they decided that they would go all in and go for the contract to run the hospital. They vastly undercut the local NHS trust. And what they discovered a third of the way into their contract was that running an NHS hospital is an expensive business. They realised what all doctors, nurses, healthcare workers know, which is that some of the patients are straightforward, easy to treat, and the amount that you get paid for treating them gives you a profit. But then a profit in inverted commas, it's not a profit to the NHS. Then you get this cohort of patients who are complex, tricky, multiple comorbidities, and they cost a lot of money. And most of the time, what they cost isn't balanced out by what this other cohort makes. So usually we're always running at a deficit. You'll have heard about that in the news lots and lots and lots. If you take out of that very, very fragile relationship the profit-making bit and give that to the private companies and leave the NHS with the loss-making bit, we're all absolutely stuffed. And what Circle realised is that actually it's really difficult to make money providing care across the board. So they walked away. They left that hospital, they left all of those patients, they walked away. It's absolutely disgraceful. Just very quickly then, just next slide, thanks Hannah, and I promise I'll be very quick with the last couple of bits. The Health and Social Care Act in 2012, that happened under, because as we've said, this isn't just one political party. So this was the baby of the Liberal Democrats and the Conservative Party. So the coalition government in 2012 got this act through, and it did a number of things. One was that it removed the statutory duty on the Secretary of State for Health, on the government, to provide a public healthcare service. That got shifted and shunted out effectively to doctors and to the health service itself. So no statutory duty. It introduced this idea of any qualified provider as well, which was the real big step. Because what this meant was that whereas GPs had been able to buy their services from any hospital, any NHS hospital, so all the NHS hospitals were made to compete against each other. Now any qualified provider meant actually all of the private healthcare companies can just throw their hat into the ring as well. So if they want to provide it, GPs can buy the services from them as well. And again, what they do is undercut to get the contract, fail to deliver, and if they're not making money, they walk away. The next thing that the 2012 Act did, and I've seen this myself, was increase the private patient provision that NHS hospitals were allowed to provide from 2%, which is a very, very small amount, and kind of a token amount, to 49%. And what that has done is fundamentally change what happens under the roof of an NHS hospital. Now, you've basically got a private hospital under the roof of every single NHS, well, not every single, but a lot of NHS hospitals, where there's a private patients unit. Private patients bump other patients, NHS patients down the list. The best equipment gets reserved in some places for the private patients, not for the NHS patients. It's a two-tier, two-class system happening under the roof of NHS hospitals. And most hospitals are doing it because they are desperate for money, because we've been so badly underfunded. That's a kind of a mini, or maybe not even mini rant from me about why I think and why we think that privatised healthcare and a for-profit NHS is absolutely the wrong thing to do. But one of the other reasons, and one of the key reasons, is actually you guys out there. Hannah, can you just pop to the next slide? Thanks. And the next one after that, because we've sort of covered that, I think, in my mini/major rant. The key reason is this: it's public opinion. The public do not support privatising the NHS. So the second point down there on the slide, 84% of people do not support, believe that the NHS should be run only in the public sector. 10% disagree with that and 5% weren't sure. Only 15% of people support private companies sitting on NHS boards. The public don't want it. It's why the politicians never say that that's what they're doing, because they know it's an absolute vote loser. That's kind of the purpose of, or part of the purpose of this briefing, is to try to educate and help you guys out there understand and spread the message that it's happening. It's not a myth that NHS privatisation is happening, and we have to do all that we can to stop it. I'm going to hand back to Julie now, because I think you're going to finish off here.
Hello. Thank you so much, Meg. No, that's fantastic. I think it's really powerful hearing Meg talking about this, because Meg's got a sort of dual hat on as a doctor and also as a barrister, and also being someone who's worked in the private healthcare system as well, which I think lends a lot of experience to this. I grew up in Jersey, actually, and I know what it's like to grow up in a place where GPs are private, and it's not good. People don't end up going to the GP when they need to because it costs a lot of money, and it doesn't work properly. I desperately feel that we need to get back to a place where the NHS is fully public and there's no private companies profiting in any area of the NHS. And, you know, you look at the figures, I would say that most Conservative voters feel the same way. You know, we do not hold a fringe view here. So it's absolutely appalling what is going on. It's awful that shareholders and private companies are, you know, that their interests are being put above those of the patients, to be perfectly honest. Could you get on to the next slide, please, Hannah? Fab. Okay, cool. So what we wanted to do is just explain a little bit now about what's actually in this health and care bill. So it's awful that this bill is going through at the moment anyway, because having just been through a pandemic, and the pandemic continues despite the actions of our government and our failure to put public health measures in place, such as compulsory masks, we shouldn't be rushing something through Parliament in this way. This is going to be a major overhaul of the NHS. It needs an awful lot of discussion, and the government should be taking those discussions to healthcare leaders, but also to patients and to the public, because this health and care bill is major. Now, what they want to do is break the NHS in England up into 42 new, what are called integrated care boards. They will be local healthcare boards, which are the people who, it says here, they'll plan NHS services, decide how much to spend, and award contracts without advertising. Now, it's not good anyway, because breaking the NHS up into 42 different areas causes further fragmentation, and we think it's going to make problems like the postcode lottery worse, because there'll be local decision making about what communities are able to get access to. So it won't be a fair system across the country. But also, in point 2, private companies are going to be allowed to sit on these integrated care boards. Now, that rings huge alarm bells for us. Meg was telling you just now about the contracts that private companies have been winning in the NHS over the last couple of decades. If we have integrated care boards making decisions about contracts, extending contracts, and even representatives from private companies sitting on the boards, then the likelihood, and we think it's extremely likely, is that more and more contracts are going to be given to private companies. And the problem with that is the sustainability behind it. Patients really benefit from having long-term health relationships with the healthcare providers, with the staff who work in the NHS. If you've got a healthcare board who has private companies' interests and is handing out contracts willy-nilly to private companies, then the concern of the patients, the longevity of a healthcare relationship between a doctor or a nurse and a patient is not going to be at the forefront of those decisions. Money is, and that's simply wrong. The other thing that these changes are going to cause is it's going to remove the duty for a public body to arrange hospital services, which is really scary. It means that if there's problems locally with hospital services, there will no longer be a duty of care to patients. And that's central to what the NHS currently does, and to be honest, what the NHS was set up for initially. Hannah, could you just move on to the next slide, please? The other thing is, at the moment, we have a situation where there's an awful lot of local knowledge in the NHS and lots of experts locally in how to manage things. It's a very, very complicated service, and a lot of the onus of responsibility falls to experts in local areas. What's going to happen from now on is that more power is going to be given to the health secretary, who might not have any experience in healthcare for a start, so they might not really understand the decisions. But also, because the NHS is such a complicated organisation, and because it's under such pressure, it doesn't really make sense for the health secretary to have to take all of those decisions about what goes on in local healthcare trusts. It makes a lot more sense for that to be managed locally. So we're very concerned about that, and so are lots of other healthcare bodies, organisations, leaders. And then there's one final point that says NHS England will be able to impose expenditure limits on trusts. So the NHS England has been pushing NHS trusts in recent years to make a lot of cost savings, but ultimately the decisions have been made by the trusts. This is changing things, so that the onus of responsibility is going to fall to NHS England, so that they'll actually be able to limit the amount of expenditure made, which is another concern. Could you move on to the next slide, please, Hannah? So we're really worried about a few things, and I know that we keep talking about this on Twitter, so you might know this already, but we think it's good just to solidify it into a few bullet points. It's not going to support the current NHS workforce, who are under just the most incredible strain at the moment. We're losing a lot of staff who are moving abroad because they're treated better, leaving professions because they're simply not paid very well, and people get to the end of their tether. You can only take so much. People aren't going into training in the same numbers they used to, and this bill is not going to support the NHS workforce going forward. There's no strategy that I could see to recruit new staff and to entice people in and support them into new training pathways, which is a huge problem in the long term. There isn't funding being put in place to address underlying core problems. Something we haven't even touched on today is that the NHS has millions and millions of pounds in basic repairs that need to be done, and this government is simply ignoring them. In some places, there's water dripping through the roof in NHS hospitals. It's truly appalling. And lastly, it fails to reinstate the legal duty for the Secretary of State to provide health services. It's really important that when a healthcare provider is in charge, that they actually have a duty to look after patients properly. And that's what you're taught at medical school. Quite frankly, I think if it wasn't that way, Meg and I and a lot of other doctors probably wouldn't have wanted to become doctors. It's the whole reason you become a healthcare member of staff. The idea that that duty of care is being removed at the highest levels takes away the care that's supposed to be underlying the NHS. So we're extremely concerned. Hannah, could you move on to the next slide? We feel that things should go back to the way the NHS was first envisaged. There's an awful lot to be done if that's going to be a reality. The problem we have at the moment is this government seems hell-bent on pushing this bill through. We know that a lot of politicians are deeply concerned about this. We've also started linking up with peers in the Houses of Lords. A lot of them are concerned. I've had conversations actually with some Lords who have come from a Conservative Party background who are concerned about this. Our hope is that people are going to rally. The public are absolutely furious about this, as they should be, and that enough pressure will be put on the government that the bill can be stalled and hopefully scrapped. If that doesn't happen, this is going to become a much longer term campaign, I would say, because politically, the UK wants an NHS. I truly believe that, and I don't think the fight stops with this bill. It goes forward into the future. Could you move on to the next slide, please, Hannah? Fantastic. Okay, well, thank you so much for listening to what we've got to say. Just before we move on to the question and answer session, I just wanted to let you know that we do have briefing notes. It's like a presentation with all the detail that we've been talking about today and a bit more, because sometimes it can feel like you're being hit in the face with an awful lot of information when you come to one of these presentations. We offer all of our presentations up for any EveryDoctor supporter. So if you drop us an email on campaigns@everydoctor.org.uk, we'll send you a copy if you're a supporter of us. And the other thing to mention is we hate asking for money because frankly, we're NHS doctors. But in order to run this campaign, we are crowdfunding at the moment. And if you were able to donate or share the link to donate on Twitter or elsewhere, we would really appreciate that, because we've got a lot more we want to do. I'm just going to talk for 1 minute about that before we move on to the questions. We've been doing a big online campaign. We've also been speaking to a lot of MPs about the possibility of setting up a cross-party group against NHS privatisation. It's hugely time consuming, but it's really important, because a lot of the politicians, even the ones who feel the same as us, don't have the information at their fingertips to be able to make sense of what's happening. And so we're trying to make that a bit easier for politicians. Our next step, we think, is to take this campaign offline and go into local communities and start meeting with people. So what we're hoping to do is set up a digital map online so that people around the country can register that they are anti-NHS privatisation. We're hoping to have ways that local businesses can register for that, let their local communities know that they're also anti-NHS privatisation, and truly build out a movement rather than simply an online campaign. All of that's going to take a lot of effort, lots of funding. And so if you can make a donation, we would hugely appreciate it. Okay, I'm just going to have a little look now, because I think the team have put together a list of the questions that you guys have been asking throughout the presentation, and we'll get cracking with those. Okay, fantastic. So thank you so much, and thank you for sticking with us, guys. So question 1 has come from someone who's here called Amir Sheikh. Thanks, Amir. He's asked, how many Conservative MPs have you managed to contact in any meaningful manner? I live in a safe Labour seat, so I haven't been able to make a nuisance of myself. Well, we've been working on this for a few months. We have emailed all of the MPs a number of times. On top of that, as you know, lots and lots of constituents across the UK have used our MP tool to contact their MP and let them register their disapproval with the bill. We're not the only organisation who've been doing this, I might add. There's lots of NHS campaign organisations who've been doing fantastic work. We have then contacted MPs ourselves and asked if they would like to meet with us individually. It's a huge problem, Amir. I'm not going to lie about it. We have absolutely worked our socks off trying to meet with Conservative MPs, and I've actually been pretty shocked to find that none of them have taken a meeting with us so far. Some peers have, but in terms of Conservative MPs, some of them even we know fairly well, because they were very supportive during COVID of NHS staff, and we were linking up with them then. This seems to be an absolute red line for them. They will not meet with us. And that's hugely concerning. And what we're hoping is that the public are going to get louder and louder on this issue, and it becomes very apparent to them going up to the next general election that the public simply will not vote for a politician unless this is the number one pledge that he is making. And so I suppose that's the only thing I can say on that. It's hugely frustrating, and quite honestly, I find it horrifying that none of the Conservative MPs at the moment are speaking out. Meg, I don't know if you've got anything you wanted to add to that.
No, I mean, I think it is just incredibly disappointing that a lot of them stood and clapped and had their photographs taken, you know, for their local newspapers and all the rest of it through COVID, but won't even have a phone call with us. I think that sort of probably speaks volumes, and I probably shouldn't say anything else. But I wish that they would. It would be great if they did. We're here because although it may seem like we're party political, we're genuinely not. We've tried to demonstrate that this evening, and we're a non-partisan group. And you know, if the Conservatives or Conservative MPs are happy to come and chat to us about what we really believe in and what we believe in strongly as doctors, then we would love to do that with them.
Absolutely. And the thing is, because we're not party political, we're coming at this just with the facts. We've done the research. We didn't actually come to this expecting to, you know, have a go at one party or the other. That's not what our organisation is here, but we're not going anywhere. We've only just got started. So we're going to get louder and louder. And quite frankly, politicians are going to have to face up to this because we're not going anywhere. Okay, question number 2 has come from Wendy Grossman. Hi, Wendy. So Wendy says, is future use of data at particular risk of privatisation, e.g. Palantir, now thoroughly embedded in providing analytics? Meg, do you want to answer that one?
Yeah, I think, I mean, my answer to that is almost certainly yes. I mean, data anywhere, but medical data is like gold. within the health service. And it will undoubtedly, well, it already is, really revolutionising the way that we care for our patients, the way we interact with patients, communicate with them. In the last hospital I worked in, we had, just on the basis of blood test results and data, were able to preemptively identify patients who were likely to suffer from acute renal failure during their inpatient stay and intervene and reduce the rate of acute kidney injury just by using the data. There was a team that had never met the patient before, and they would go around and go, hang on a second, the numbers, the data are starting to tell us that it's very likely this is going to happen. We're going to get in, we're going to jump in, we're going to treat them now. So it's absolute gold. My problem, and I suspect you guys will all probably feel the same, is that, or the problem is that where there's gold, then there are private companies who want some of that gold, and they want to make more gold out of the gold. And so letting private companies in to the same room as medical data is probably a bit like letting the fox into the hen house, and needs to be very tightly regulated. And for my money, it ought to be something that the NHS is adequately funded to do itself, rather than have private companies coming in and making profit out of data, out of patient data. It's your information. No one should be profiting out of it. But insofar as they are, that profit should be being poured back into the healthcare system, shouldn't be going into shareholders' pockets and offshore tax funds.
Thanks, Meg. Yeah, totally agree. Okay, so question 3 from Daphne Hughes says, apart from signing petitions and writing to my MP, what else can we, the public, do to change the course of the governmental trajectory along the privatisation route? I ask, having been a former NHS health practitioner for 38 years, and I'm very concerned about the erosion of the publicly funded NHS further. Well, this is something we consider an awful lot, Daphne. And actually, I had a really interesting conversation with someone the other day about this, who's campaigning about the online harms bill. And the phrase she used was, this government is a government who takes U-turns based on headlines. So I would agree with that. We have actually forced policy change in various areas over the last couple of years, during the height of COVID in particular, on various issues. It doesn't tend to be because the government will respond to emails, reply to things, or that Conservative MPs are sitting down with constituents and listening to concerns. What tends to happen is if the public anger about a particular issue becomes loud enough, and so loud that the government cannot ignore it, they will make an immediate U-turn on things. And they've done it on a number of things. I'm sure that you've been as aware of that as we are. So our ability to talk to people online is really the thing that is going to push this over the line. We need to be connecting with other NHS campaign groups, which we're already doing. There's a lot of cross collaboration, and building this movement as strong and robust and loud as it possibly can be, because that is the only thing they respond to. So even though it feels very frustrating sending email after email after email to MPs, I suppose we sometimes hear the behind the scenes gossip about what's actually going on. And if an MP receives hundreds of emails from their constituents, they might not reply, and they might not be publicly meeting with organisations such as ours, but it does really rattle them, and they will be putting pressure on the cabinet, and change does occur. So we just need to keep going, really, I think. Question 4 from Kathy Allen. Some hospital management groups have managed to pay off the PFI because it's cheaper than continuing to pay the lease charges. I assume this is not an option now. Meg, would you be able to answer that?
Yeah, well, it should still be an option, and it would be by far the most sensible thing to do. And as I mentioned earlier, that the initial investment was £11 billion, and the total repayment will be about £62 billion. Don't forget that last year, Dido Harding was handed £37 billion to set up a test and trace system that's never worked and still doesn't. So the money is there, and we could buy it out. One of the reasons that governments of the nature of the one that we have, and the ones that have facilitated all of this, don't do that is because their mates are raking in the profits, and why on earth would they annoy their mates? But by far the best thing to do for the country would be to buy it out. And I think that was actually a Jeremy Corbyn policy, or the Labour Party policy under Jeremy Corbyn. I think it's incumbent on all parties to do proper work in relation to that, work out exactly how much it would cost, and work out exactly how much how we would do it, and get out of these contracts. I mean, they are absolute scalping contracts, and we should never have gone into them, but we should absolutely be doing everything we can to get out of them.
I'm very aware of the time and we need to cut off at 7 o'clock. So I'm going to answer a couple of the questions that have come in, and the rest of them, we've been sent some really useful questions and I don't want to ignore them. So if anybody wants to have these questions answered and I don't get to them, would you possibly email us on campaigns@everydoctor.org.uk and we'll get back to you tomorrow, and we'll make sure we get back to you quickly. It's just, I'm just very aware of the time now. Okay, so I've had a question from Tanya, and I was wondering if you could answer this, Meg, because I think it's really interesting. How is it that private companies can walk away under the contract, as in the case of Circle? This suggests that the contracts are negotiated with the terms in favour of private companies.
Yeah, I think the short answer to that is that they are, and that for big companies like these, paying any penalties that are that become payable pursuant to a breached contract is just their cost of doing business. Just as, for example, in the US, a number of the big private healthcare companies have had to pay pretty hefty fines for fraudulent activity, for substandard care that's been provided. For them, it's the cost of doing business. It's a bit like a Premier League football club that breaks some of the rules and gets fined, £1 million. They've got it. They'll break the rules. It's better for them to have the great player. They'll do better in the long run, and that's how this kind of works. But yeah, they are being given favourable contracts, and they can afford to breach them and walk away if they need to.
Yeah, absolutely. I'm just trying to go through the questions and see if there's any that are repeated so that I can answer those specifically. So we've had a few questions from people who are asking how we're collaborating with other NHS campaign groups, and that's a really important thing to bring up. Even on Twitter, which is where we spend a lot of our time, there's several different hashtags, lots of different campaigns. We're trying to share other people's actions as much as we share our own, to be perfectly honest. For example, this evening, there was a fantastic rally going on at 5 o'clock that was done by Unite and We Own It and a few other groups down at Westminster. We've then been doing this. There's a Boo the Bill thing happening in 8 minutes time, which is about going outside and basically booing and banging your pot and acting as if you're very angry about the bill and talking about that. And then we have an action happening later on this evening, which we'll tell you about later. We're all emailing each other. Basically, there's an email thread between a lot of these different groups. We update each other daily. We have meetings with one another. Someone has specifically asked, how are you working with your NHS Needs You? We text each day. I mean, I made a video for your NHS Needs You. They've asked me to make another one. We get invited to do collaborative things with them all the time. We don't see any point in being competitive about any of this, to be perfectly honest. The more people speaking up about this, the better, and we think they're doing fantastic work. So that's how we feel about all of that. I've had maybe one last question, Meg. Can I ask you to answer this? So I'm not sure basically on this, and it's maybe something we need to pay more attention to, but the question has come from Ruth Forshaw. Thanks, Ruth. It says, is there any data on how many MPs have a large financial interest in the PFI or the private healthcare sector?
That's a really interesting one, Ruth. The answer is, I don't know how robustly it's been put together, but I found this was in the time, around the time of the Health and Social Care Act, so back in 2012, some of the newspapers ran a list. I will try and uncover it again and see if we can find that. But I've myself then looked to try to find out subsequently, if that list was ever updated. And I've been unable to find an updated version of that list. But the answer is a substantial number across both of the Houses of Parliament, and actually, interestingly, across certainly all of the three major parties. There are people who have got substantial financial interests, and it's not just the private healthcare companies either. It's all of the sort of supporting companies. So a lot of the big law firms, the top 5 accountancy and management consultancy companies are really tightly entwined in all of this. They've woven themselves into the system, and there are, of course, lots and lots of MPs who have interests in those. There's also the revolving door that is well known about, which is from those companies into government as special advisors, or sometimes as MPs, and then back out when they lose their seats or when they leave. They go back to the company, taking all that know-how and knowledge with them, and all of those contacts. And we kind of know what happens with contacts and government members and MPs at the moment, and we've seen that last week. So So we'll do some work on
Fantastic.
it, but there is something out there. So we'll try and find it, and we'll get it out to you guys. We'll post it up, either put it on Twitter or somewhere similar.
I think there's one last slide, Hannah. Would you mind seeing if there is? Aha, I hadn't imagined it. Fantastic. Okay, so you know, with any of these presentations, people are obviously asking, what should we do now? What's the next step? So we would advise you to contact your MP and express how you feel about the health and care bill. You can either do that by going to the gov.uk website yourself. It's actually very easy to find your MP's email address that way, or use one of the MP tools which are currently being circulated. We had one. There's currently an excellent one from your NHS needs you. Let's say your MP needs you then, which we'd really recommend you use. We would really appreciate it if you could help donate to our crowdfunder, because that's going to help us to build a digital map, take this campaign across the UK and start meeting with people in local areas and building links for people. We think what will build a lot of power behind this campaign is if people can start talking about the impact it's having on their healthcare system, their hospital, their GP surgery, how things are getting fragmented in their own areas. And so that's our ultimate aim, although that's a huge job. And we've got something happening later tonight. So if you could come back online, I can't tell you the exact time because we get worried that that we'll be thwarted if we're, you know, if we tell you exactly when something's going to be happening. But sometime in the next few hours, we're going to be doing something to create an awful lot of noise around this bill. So please keep an eye on the @EveryDoctor UK Twitter account. And thank you so much, everybody. We really, really appreciate all of your support and for you coming along tonight and hearing what we've got to say about this. Thank you so much. We'll probably be speaking to you online later. Take care, guys.
Thanks very much.
Bye-bye.